I'm Dr. Randall Feingold. If you're joining us tonight, we're going to be talking on men's health. Hi, Donna.
Hi, how are you? Good evening.
Those of you who may not know me, I'm Dr. Randall Feingold. I'm a plastic surgeon, one of the founding partners of New York Reconstruction and aesthetic plastic surgery in Great Neck. I've been in practice for 32 years, taking care of women and men who've been forced to undergo surgery for either breast cancer or gene mutation or a strong family history of breast cancer and taken them through difficult processes. Part of our practice focused on our patient empowerment program, which we still emphasize to help people with the psychosocial aspects of dealing with diagnoses and body-altering surgery. And as an outshoot of that, we founded an educational website called breastreconstruction.org, which is now a 501c3 entity. And its purpose is really to help people through education and support to feel empowered, to understand the process that they're going through. If you go to the website for breastreconstruction.org outside of Instagram, you will find all the descriptions of indications for surgery, the types of breast reconstruction, the healing processes, patient stories, visual timelines, and there's really a wealth of information for you. And on that website is also very interesting information about our annual gala, the Uplift, which is occurring in September this year at the Garden City Hotel, if anybody's interested in learning about that or joining. But tonight, our topic is on it's June Men's Health Month. I don't know if anybody can mute their phones if they're not talking, so I'm just getting some feedback from somebody's microphones. But it is June Men's Health Month, and our conversation tonight is called Strong Doesn't Mean Silent, Physical and Emotional Impact of Men's Health. So I'm going to start by saying that for generations, men have often been taught to push through pain, stay silent, and put everyone else's needs before their own. I can identify with that as a man. Tonight, we're talking about why we're speaking up, seeking help, and prioritizing health for men. And doing that is actually a sign of strength. I'll just tell you an anecdote of how I was personally affected. Most of my patients are women, but occasionally we see men with breast cancer. And about a dozen years ago, one of my best friends came to me for some body contouring surgery. Very fit, very athletic, proud of his body, working out. And I diagnosed on him a lump on his chest that he was not aware of. And in the course of doing surgery, maybe I didn't really want to believe that it was a problem. Afterwards, the pathologist called up in a panic to say, do you understand this is a breast cancer you just found there? And so I had the unenviable task of having to tell one of my best friends that he had breast cancer. And then my role shifted, and I took care of him through his cancer surgery and reconstruction. And that really hit home hard. And, he was also, kind of that virile masculine look, and didn't really want to believe this was happening, but he took it in stride, and he really, he was a champ going through it. I'm going to introduce our other speakers tonight. I'm here with Donna Bacon. She's a professor in the Health Studies Department at Nassau Community College, standing on the front line of breast cancer advocacy. She's the founding director of Mid-Nassau Lend a Helping Hand. That organization provides crucial emergency financial services to support women undergoing breast cancer surgery, treatments, and reconstruction. Dr. Bacon is a licensed clinical social worker, private therapist, certified thanatologist, completed her doctoral dissertation at Columbia while undergoing chemotherapy herself. Dr. Bacon has dedicated her life to education, empowerment, and health promotion for underserved individuals and communities, and as a board trustee for different community agencies, Her greatest joy is raising and uplifting her talented 7-year-old daughter, Reese. I'm also here with Louis Tuma. Thank you for joining us, Louis. He is a breast reconstruction patient, a breast cancer survivor, advocate, a carrier of the BRCA2 gene mutation, and he is passionate about raising awareness for breast cancer that affects men as well. In 2023, after noticing changes in his body and trusting his instincts, Louis was diagnosed with a stage 1 invasive breast cancer at just 33 years old. Genetic testing confirmed that he carried the BRCA2 mutation, a hereditary gene mutation that in fact runs in his family. Following a double mastectomy and reconstruction, Louis faced not only physical challenges of cancer treatment, but the emotional journey of redefining his sense of self and healing from an experience that many people don't realize men can face. And so tonight, Louis is going to share with us his story to encourage others. Listen to your bodies, advocate for your health, and understand the importance of early detection. His message is simple but powerful. Breast cancer does not discriminate by gender, and early detection definitely saves lives. So I'm going to start by asking a question. When you hear the phrase, strong doesn't mean silent, what does it mean to you? Donna, can you give us your perspective?
Sure. I think that for many men, traditional masculinity often rewards emotional suppression. We see that men are, they are often taught that to be strong also means that they are socialized to disconnect from their bodies, push through it, don't complain, be tough. And I think that many times what happens with men is they begin to interpret pain as something to tolerate rather than to investigate. So neglecting their care, it's not them shirking responsibility, it's more conditioning. And they think that tough equates to coping, that being tough equates to swallowing pain, not discussing it. So I think that what happens, a lot of men also begin to want to handle alone, not to burden their families. And that then becomes them dealing with a lot of pain on their own and without support. The idea that men are supposed to be tough, it gives this whole feeling to suppress, to not to express any emotion except for anger. So fear, sadness, vulnerability then goes by the wayside, and what they do not express emotionally many times shows up physically.
So Louis, from the patient's perspective, when you hear the phrase strong doesn't mean silent, how do you interpret that?
Well, basically, it just takes you to a place where you feel that you have to not show emotions. You basically have to put up front that you're a man and you have to show strength when maybe inside you're hurting. And I suffered a lot of that through this journey. So I agree with what Donna said as well.
From my perspective, I find that male patients in general are stoic when it comes to a diagnosis that they didn't equate with something that happens to men.
Right.
Exactly.
That prompts, silence on their part. Donna, why do you think so many men struggle to talk about their physical health or their emotional health?
I think that for many men, health challenges don't simply affect their body, it's their identity. It affects their identity. And, for men, many men connect identity to being a provider, being a protector, their physical strength, their independence, their sexual functioning even. So the illness tends to trigger shame, fear, loss of confidence, feeling not like themselves. And a lot of times I think a lot of men will say, the greatest pain, the men I've worked with would say the greatest pain really wasn't the surgery itself, but as we discussed, where their fear and anger and their vulnerability and it led within them, they would say that it was kind of, who am I now if I can't function the way I did? Who am I now? And we deal with this with not only men with breast cancer, but other cancer, prostate, and things like that. So I think that a lot of men equate health challenges to affecting their identity as being a man, a provider, and a strong man who deals with things, especially with breast cancer, that they don't deal with things that are typically, something that women deal with.
Louis, before your diagnosis, before your treatment, were you someone who openly talked about your health?
No, I was someone not openly talk about. I was more of a private person. I think that after my diagnostic, I was a little bit, well, before my diagnostic, better yet, I was one of those men that was often dismissive, thought that any symptom, anything new wasn't wasn't something of seriousness, because I think that also led for me going to doctors, and the doctors telling me either I was too young, or the probabilities, the statistics of us having breast cancer in men was very low. It just created in me a self-confidence that wasn't realistic.
So if you got a symptom, from anything, could be a cough or a headache or whatever, you didn't run to the doctor quickly. You
Not,
tended to.
not at all. Because when I would do it and I would go, I would come out with everything was all right. I'm young. It's probably a cold that I can fight. So age was a lot of the main factor of me. If I would have not been my advocate, not finding things on time, because a lot of doctors believe that, oh, yeah, either I'm too young, or breast cancer, you have to be a female, or for you to do any type of testing, you have to be a certain age, such as colonoscopy, endoscopy, etc.
So has that changed for you? Would you say that now, if you develop them or some sign, that you would be quicker to go to a doctor?
Oh, absolutely. Especially now that, that I'm a BRCA2, I think they take me more serious. Having gone through what I went through and them seeing that as a history already at the age of 33, which they consider as young, works to my benefit. And also me being a male and not a female per se, and having that illness.
So, in terms of your story, what was your first, sign that something wasn't right? What led you to seek treatment?
Well, it was like an ordinary day. I was literally at home just watching television. I kind of laid back in my recliner, and I felt a little bit of a discomfort on the left side. So when I touched that area, I did feel a lump the size of a pea. At the moment, I wasn't so concerned about it, but it did bother me because it's not something that it's normal to be there. I reached out to my mother. Usually, I always do when it comes to health, because she's like my little advice. And she told me not to pay attention to it, but that she didn't think it was anything serious either. And approximately 2 months later, I reevaluated myself, and I noticed that it was slightly bigger, but not big enough for me to be, worried, but it wasn't going away either. And that took me to actually, to seek help. I went one day after my shift here at work, and I went over to the emergency room. And when they assessed the situation, I knew that it wasn't good at all.
So you went to an emergency room for care?
I Yes.
So,
My
so
initial
care doctor.
Well, after I went to the emergency room, he did send me to reach out to my primary doctor, but they still gave me a referral to radiology. But in order for radiology to see me, I needed from my primary doctor to send a referral.
So were you already tipped off in your mind that
Yep.
was heading to a breast cancer diagnosis?
As soon as he put breast center and radiology on there, those were the two words I remember seeing on that paper. I already knew that what was coming wasn't good.
Did you have any support going through that early process of figuring this out?
I did. I had my aunt that's also a BRCA too, and she also had a double mastectomy, Marilyn. I had my partner Daniel that never left me alone, was with me through the whole entire process. And my mother was somewhere by my side. She had to leave my side to go attend my grandmother, because my grandmother also had breast cancer the same exact year as I was facing it. And I asked her too, because my grandmother was older, I was younger, and I felt that I was stronger to fight it.
So, I don't find that typical, because having taken care of other men with breast cancer, I find that they're pretty reluctant to share that information, even amongst family members, and they might maintain denial for a longer period of time. And I feel like they don't want to burden their family members they don't want to reveal that they've got such a problem, and so they're taking a hit unnecessarily when they should probably, get the assistance of family members and friends and other resources, to help support them through these, processes.
Mm-hmm.
Donna, how can spouses or partners or families encourage men to seek help?
You bring up a great point with the first statement that you said, Dr. Feingold, is that I think for men, often they suffer quietly, silently. They feel that silence is the same thing as coping, and it's not. And we see men who may look completely functional on the outside, and they're carrying enormous fear and emotional exhaustion. And I think for a lot of men, what they will do in carrying that they'll start to overwork. They'll start to self-isolate. They'll withdraw. They become withdrawn. They become irritable, right? There's just all these little distractions. But we know that healing happens in relationships. So support can look like partner support, friends, someone checking in, therapy, right? I think that there's sometimes stigma around therapy. I want to express to men that doctors many times focus on the physical recovery timelines, but therapists focus on the emotional recovery timelines. And the body may heal faster than the mind adjusts. So a lot of men, even though they're physically able to go back to work and do the things they did, emotionally, they still are carrying the burden of what happened, the surgery, the emotional ramification of it, and what they're left with. So I think that for supporting the men that we love, it's very important that support does not sound like pressure. I think as wives, as partners, sometimes we'll say, go to the doctor, you need to go, as opposed to, I care about you and I want you here for a very long time. Let's work on this together. So being supportive is just sometimes adjusting our words a little bit so that they don't sound like pressure, they don't sound like ultimatums, they don't sound like nagging. And I think that's important for the people in the lives of men dealing with different illnesses.
Louis, looking back, what advice would you give someone, if they're maybe hesitant to seek care?
Basically, to listen to their body and definitely to trust their instincts. I mean, nobody knows their body better than themselves. If something feels different, unusual, or something doesn't seem right, they should definitely not ignore it and seek medical attention right away. For me, it would have been easy to dismiss the lump. Since I was young, I felt healthy and a man. Breast cancer never would have passed my mind. However, cancer doesn't always follow statistics nor gender, and it doesn't mean rare cases can be impossible. I would tell them not to fear, not to let embarrassment or assumptions prevent them from getting checked, because I was in that place many times. The uncertainty of what the future holds for me, how I was going to look at the end, my physical aspect, my emotional aspects, if I was going to be here.
So starting with the physical, challenge, how would you describe that process that you went through, and, were there physical challenges, and how did it affect your everyday?
There was plenty of time. So, in my mind, I always describe myself after I had the mastectomy like a puzzle without pieces or missing pieces. Better yet, remember, I don't know if you remember, when I first met you, the first thing I said was, when I met my surgeon and I asked him about reconstruction, he said there was no reconstruction for men. So it destroyed me, because now I felt like I was going to live marked forever. I was never going to look like before, so I was never going to be the same. I could never even see myself in the mirror. It took me to an isolated moment where I didn't even want to speak to people around me, the people that were there for me. It took me to a real dark place.
So that was before the surgery, correct?
That was before the surgeries, before I met you, and I found out that men's do have reconstruction. Then we did the fat grafting, and every time I did each surgery, I was excited, because I was like, well, I'm gonna wake up and look how I want to look, and I had a picture in my head of what I wanted to look like. Obviously, as we know, with fat grafting, is not always 100%, and you have to do most of them. You have to do a couple of them for it to look perfectly or similar to perfect. And then I came over to Feingold and I asked him about the pictorial implants, and that to me was the piece of the puzzle that was missing. When I woke up, I would never forget, I had a smile that wouldn't go away.
I just want to go back to that statement you made, because it made me pause. You said it took you to a dark place. And this was, getting a diagnosis and being discouraged by the breast cancer specialist, not giving you, perhaps hope about what was going to be. So there was a moment where there was missing information. And because there was missing information, you didn't know where to go, and you couldn't really have imagined that there was going to be a good outcome. And that's the purpose of not just this Instagram Live, but it's the purpose of the website, reconstruction.org, and all of its patient stories and visual timelines, is because if we're able to give people knowledge, the word empowerment is, perhaps overutilized. But what it really means is it restores hope for people, and it makes them optimistic, and that gives you, quality of life, right? In order to function every day and get peace of mind. But physically, you had to endure some discomfort, right? These are surgeries.
Yeah.
It's not like getting a haircut. But now you're on the other end of it, right?
Correct.
And perhaps you could just comment on how the emotional side of this journey, changed for you.
Well, it was ups and downs. There was moments where I felt accomplished and I was getting somewhere, and then again I would fall again, and then I would get up again. It's not something that I think I could really describe, but I do know that, for men, I know that they say that for a woman it's harder because the breast is a part of a woman that makes them feel like a woman. But for men, I feel it's harder because there's a stigma around that whole breast cancer is only for female. And when a male gets it, they look at you like, men get that? Like today, I was just telling my coworker I was getting on this call, and he was like, I never knew men get breast cancer. I thought that was only a woman thing.
So, Louis, you've very successfully come through this process, particularly from a mental health and emotional perspective. But Donna, I have to imagine there are signs that someone is, foundering a bit and need support. How do we identify that in people? How
Yes.
can we tell that people are in trouble?
Yes. Well, thank you so much for sharing that part of your struggle with us, Louis. I think it's important. I think for many men, depression looks different. It doesn't look, typically the way we think depression should or may look. It's different from what people expect. I think in many men, we will see them sometimes withdraw, become irritable, maybe increase, things to distract them, oh, he's working a lot, so he must be okay. But the overworking, anything to kind of numb some of that emotionality that's coming up. Sometimes it's increased drinking. Sometimes it's doing things that you normally would not do. Anything to numb what you're feeling. And I think that as partners, friends, we need to look out for those signs and speak up if you see something going on. I think also as partners or friends, sometimes we're afraid to say, how are you feeling? Do you feel bad? Do you need help? I can just listen. I can just be here. Have you thought about going to speak to someone? I think people are afraid to say that, but it's very important if we see those signs to speak up.
Do you think that stress and anxiety can affect recovery outcomes?
Yes, absolutely. We know that when people lack support and a place to lay their vulnerability, and again, we know that many men have many social circles surrounding activity and sports and work and hobbies, but not necessarily places where emotional honesty is normalized. So when we see men who struggle, and we know that stress lowers immunity, which then also can trigger cancer and other, cardiovascular issues. So yes, stress, anxiety, sadness, depression will also impact the ability to heal effectively, emotionally and physically.
So, what advice would you give to someone who is that friend or family member supporting their loved one through this kind of a challenge or recovery?
Yes, first of all, in general, I think as people in the lives of men, I think all of us need to normalize doctor's visits, encourage conversations about general health, watch for mood changes during treatment or recovery, treat emotional safety, just say, I'm here to listen, watch out for changes in behavior. check in with the person, search support groups such as we have at NIBRA that are specifically for men, patient empowerment programs, counselors who specifically deal with men and medical issues. I think that's very important. And as a person who's in a man's life, I would do that research for them as opposed to say, you need to speak to someone. Give them a number, give them a name, make sure the insurance covers it, that kind of thing. Kind of do the footwork for them. And I think that that is very important. And if I may, Louis, if I can ask you, what would you say was one of the most, what helped you the most during your journey? Would you share if you can think? What was very, very helpful to you so that you can tell people as a person who lived through it, what was really, really, really one of the things that worked well for you as you recovered?
I looked for something to do, something that was going to entertain my mind and take me off of this while I was going through this journey. So for me, for example, going to the gym was one of the things that actually helped me, motivate me. I try to find different hobbies and really try to keep my mind away from this situation, because the thing is that I was falling into anxiety and depression, and like I was telling Feingold, emotionally it took me into different places. Like when I first found out, I had fear, uncertainty, disbelief. I was even isolated at one point. And then, while the diagnostic came and things started happening and the operations and me looking at me going from one Louis to another Louis and what I call a new Louis now, all of that takes an emotional and mental toll on a person.
Thank
But
you.
I think also I heard you say your partner was a factor too, right? Because
Yeah. So yeah,
are pretty
that was another thing. While I did find out that I was sick, he didn't give me the opportunity or the space to overthink it, think of the worst or the negatives. We were always looking for something, to take my mind off of it. But we also, when it came to this illness, we also took it very seriously. We did our research, we read together, outcome, we found Feingold, and, he gave me the light of hope that I wasn't going to be marked for life, that there was going to be a light at the end. And pretty much that's how it was.
Donna, do you have any closing thoughts that you want to give our audience?
I think that, to every man listening, just remember that your body deserves attention. As you heard what Louis said, that he felt his lump. To pay attention to your body. If something feels different, don't shoo it away. Go in to speak to someone professional about it. Your mind deserves care. Your pain deserves language. Your strength is not suffering in silence. That is not strength. We need to redefine what strength means, as opposed to I can handle it alone. Maybe think of I care enough about myself and my family to address this early. Kind of rethink what strength means. And sometimes the strongest thing to say is not I'm fine. Sometimes the strongest thing to say is I need help right now. I need help. Strength and vulnerability can coexist. So you can be strong and vulnerable at the same time. So I just want to remind people of that.
Louis,
Yeah, I do have to agree. I learned that being vulnerable is not weakness. Opening about my diagnostic, at least to me, giving me the support that I need. I opened up connections with other people in ways that I never imagined. I also think that one of the greatest lessons I learned is that strength doesn't mean facing everything alone. Sometimes strength means allowing others to stand beside you, to access help, to learn and lean on other people that care about you. The support at least made all the difference with my journey.
from the doctor's perspective, I just want men to understand breast is not a female organ. We all have breast tissue. Every living person, male or female, has breast tissue, and breast cancer is not a women's disease. It's a disease of breast tissue that we have, and men definitely need to be aware of their bodies. They need to look. They need to practice self-examination, whether it's a breast or a testicular exam. Young men form cancer of the testicle. There are male-specific diseases like prostate cancer that probably 80 or 90% of men have if they live into their 70s or 80s. That may not even be something that hurts them, but it's just there. And we just have to accept the fact that as we age, something could change. you definitely want to bring it to attention and get help. Because most of the time it may be benign, and it's the fear of diagnosis that leads to the delay in recognition in men. And the thought that breast cancer is a worse disease in men with poor outcomes definitely relates to delayed diagnosis because of men either not examining. We're not on monthly or annual or biannual programs where we went for, for breast cancer detection. We're kind of left alone to do it. And then you understand you should just be aware of yourself. And men don't have to have a worse outcome than women. They just need to detect it early enough. And if something changes, you definitely want to bring in another set of eyes, even if it's just a spouse, partner, family member. Go to the doctor, check it out. You'll probably be fine. If anybody wants more information about this, you should definitely come to the educational website, Reconstruction.org. Anybody who's viewing this, if somebody needs this advice or finds themselves in this situation, share this live with them because it's archived on our website. So this conversation can continue. No matter how many people are listening tonight, there will be 100 more people that see this over the next couple of years or 2 years because it's going to be perpetual on our site. So I want to thank all of our participants for joining us tonight. I want to thank the audience for joining. I think we've answered everybody's questions. And have a great night, everybody.
Good night. Thank you for having me.
Good night.